What are asthma lung function tests? Have you ever wondered how doctors figure out if someone has asthma? One of the key tools they use is a series of tests known as lung function tests. These tests are designed to measure how well your lungs are working, especially when it comes to asthma symptoms. Lung function tests help doctors assess airway obstruction and lung capacity. They can show how much air you can breathe in and out, how fast you can exhale, and how well your lungs transfer oxygen to your blood. This information is vital for diagnosing asthma, monitoring its severity, and guiding treatment decisions. The most common test is called spirometry. During this test, you take a deep breath and then blow out as hard as you can into a device called a spirometer. This device measures two important values: forced vital capacity, which is the total amount of air you can blow out after taking a deep breath, and forced expiratory volume in 1 second, which tells how much air you can exhale in the first second. Doctors often perform this test before and after you inhale a bronchodilator, a medication that helps open your airways. This helps determine if your lung function improves, confirming asthma and assessing treatment effectiveness. Another useful test is the peak flow meter test. This measures how fast you can blow air out of your lungs. While it is not as precise as spirometry, it is handy for daily monitoring at home. It can help you detect early signs of worsening asthma and identify triggers. Bronchial challenge tests are also important. In these tests, you inhale a substance that can cause airway narrowing in sensitive individuals. If your lung function decreases significantly during this test, it supports an asthma diagnosis. Lung volume tests measure the total amount of air your lungs can hold and how much air remains after you exhale fully. This helps identify if air is trapped in the lungs, which is common in asthma. Gas diffusion tests assess how well oxygen passes from your lungs into your bloodstream. This can be affected in individuals with asthma. There is also the Fractional Exhaled Nitric Oxide test, which measures nitric oxide levels in your breath. Higher levels indicate airway inflammation, which is typical in allergic asthma. This test helps in diagnosing and managing asthma by indicating inflammation levels. Lastly, exercise challenge tests evaluate if physical activity triggers asthma symptoms. They monitor lung function before and after exercise to see if there are any changes. These lung function tests provide objective measurements that help doctors confirm asthma, evaluate its severity, and track responses to treatment. They are essential tools for managing asthma effectively and preventing flare-ups. Understanding these tests can empower you to take charge of your asthma management.